One of our treatment techniques in the graded motor imagery program is actual motor imagery or visualization. There are many different ways of doing it. In this case, we want the patient to imagine a movement, a position, or a task without actually doing it. We now know that the premotor cortex actually fires significantly via mirror neurons. You use the same circuitry thinking of a technique as if you are doing it. But in this example, if a patient has significant pain, they imagine the movement, the position, or the activity, but it does not evoke pain, or better yet, it evokes pain, but pain that is understood. It is a win for the brain. And in this case, we will use the Hebbian theory of nerves that fire together, wire together, but we're going to do the opposite, and nerves that fire apart, wire apart. Run the map, no pain or very little pain or pain that's understood, unwires the map, and our patient's pain can actually ease. For today's example, all we've done is we've created a series of cards. We've taken a model and had him put his arm in different positions. So the easy phase for the brain is going to be first to go through static movements. In this case, I'm going to ask Heather to look at a picture. Look at the picture. Imagine her arm in that position. That's all it is. Close her eyes. We may expose her to this thought process that's running of the map for 2 or 3 seconds. By the way, by having to do it longer, can add more challenge to the brain. So we start simple. 2 or 3 seconds becomes 4 to 5. We can work our way through this process. To do the actual movement, to imagine the movement, takes more work. So for this one, we're going to do static positions, followed ultimately by some movements. So Heather, I have a series of cards here. All I'm going to have you do, we've placed them face down, is I want you to pick up the card for us, look at it carefully, place it face down, and then close your eyes and imagine your right arm in that exact same position. Deep breaths, 2 or 3 seconds, and open your eyes. Fair enough? Go ahead. And she'll continue this process, picking up a card, looking at it. If a patient encounters an image that is upsetting, frightening, we will ask him to put it aside. And we may come back to that later on. Remember, this is a part of graded exposure in our patients. As Heather gets really good at this, I can then say, see where the arm is. For example, the model's arm may be in forward flexion at about 90 degrees. And I may ask you now, close your eyes and slowly imagine your arm raising up. By the way, we can talk her through the process. Your arm is gently raising up. It feels good to move the arm again. So we can coach her through the actual thought process. And this is going to be motor imagery. But remember, her actual arm that is involved is not doing the task. The fourth